world of medicine has changed quite dramatically since the days of the family doctor who had an office down the street and actually made house calls. Today, the family doctor is more commonly known as a primary care physician or internist, and many, if not most, are members of group practices. And here, the city of Dallas is home to one of the most unique and medically complete internal medicine practices anywhere in the country. These are the offices of Dallas Medical Specialists. We are located in what is known as Medical City Dallas, both of which are divisions of HCA, the well-known Hospital Corporation of America. The practice consists of 8 board-certified doctors, many of whom have known and worked with each other for years and have long-standing relationships. While this medical group is about as technically complex with as many tests and equipment as any private medical group could possibly desire, the overwhelming goal here is to allow the doctors time to really get to know their patients. It's something they pay an overwhelming amount of attention to, and as a result, the patients truly benefit. To learn more about this practice, we spoke with the doctors and many of the staff members, including the team's medical director, Dr. Sean Murphy.
We have a facility that we can provide a variety of services in-house, including laboratory, x-ray, same-day visits. We become the total family doctor. We become the quarterback for the other doctors. Because we're at Medical City, which is a big hospital with a large number of specialists, sometimes patients can get lost between going to the specialist that focuses on their stomach problem or their heart problem, and they need somebody who can say, this is the best thing for Mr. Jones.
I feel confident with what they do. Usually have no problems getting in and out and scheduled, and just the fact that they talk to you. Dr. Murphy sits down with you and explains what's going on and what he thinks. He's not trying to talk down to you, and they don't seem to be rushed. You know, they concentrate just on me when I'm here.
One of the biggest advantages we have here at Dallas Medical Specialists is our sheer size. There's 8 physicians that work here. We all have very similar practices, and in that way we can provide the highest quality of patient care in response to, patients being able to get same-day appointments. And if I'm out of town, I always have coverage, and I don't have to worry about whether my patients are being taken care of or not. We really wanted to put together like a boutique practice.
Yeah.
So we had one philosophy, and that was basically to provide the highest quality patient care possible. And we always asked each other, like, what would you like if you were a patient? What is the things that you want? And people said we want access to our physicians. So we made sure that you're able to get in the day you call, by our sheer size.
The office is great, from the scheduling front desk and the doctors, specifically Dr. Stock. She's very supportive, goes out of her way to be personal, not just patient doctor. She takes her time. Last year I had a breast cancer scare, and she got me through that. A lot of support for myself and my family. She's always optimistic, always optimistic. You come to talk to her about anything, and she always looks on the positive side of things, never negative. So she talked to me early in the stages. I think that helped a lot for all of us. Have a positive attitude instead of worrying, and one step at a time. Let's take the test, see what happens, and then we can go from there. So she's always on the positive side, never negative.
We have specialists and we have subspecialists. And a lot of times when patients see those doctors, they focus just on a narrow aspect of their care. And patient needs someone to sort of take a step back, look at the overall picture, and try to put the puzzle together for them. A lot of my patients have multiple problems. They see 2, 3, 4, sometimes even 5 different doctors. But those doctors only look at a certain particular, very narrow part of their care, and they come to me to try to put the whole picture together and to explain things to them.
I had an instance where I had a terrible accident, terrible fall, and it broke my face up quite badly, and I needed reconstructive surgery in order to come back with a face, except that taking Coumadin, which I do for AFib, atrial fibrillation, is a little bit of a challenge. And the doctor who was going to do the reconstruction was a little bit nervous, and he's talking with my heart doctor about how do I get off of Coumadin to do this. But who really made it happen was Sean Murphy, my family physician, because he got on the phone with my heart guy, he got on the phone with the plastic surgeon, ear, nose, and throat guy, and kind of orchestrated the whole thing so it happened very smoothly. Even though it wasn't his main responsibility to make it happen, he sort of turned out to be a make it happen guy.
The range of patients the Dallas medical specialist sees is truly vast. A number of different languages are spoken here in addition to English and Spanish, including Vietnamese, Hebrew, and even Farsi.
In this group, we have several physicians who speak different languages. We cover Vietnamese, Spanish, I speak Hebrew, and that helps us attract lots of patients who speak different languages. What appealed to me about internal medicine was the large scope of the field, being able to address primary care issues, prevention of heart disease, keeping people healthy. I'm most interested in things like cholesterol metabolism, reducing cardiovascular risks, travel medicine.
It appears to me, at least, that the wait time here for patients is drastically reduced compared to most medical practices.
One of the ways that we also keep wait times down and maintain our ability to spend time with patients is we don't schedule patients every 5 minutes. We actually allot enough time per patient to give the doctor comfortable, ample time to see a patient and properly evaluate them. We try to maintain our schedules in such a way that we aren't overwhelmed with patient loads, that we still have time to treat each patient individually.
We have a lot of subspecialists here at Medical City in every discipline that you can imagine, so it's really nice to have our specialists readily available to us. We have teams of cardiologists who are literally right around the corner, and so we can quickly address the patient's needs. And also, if we see something that's a little bit perplexing, it's nice to know that, I can pick up the phone and call a specialist and say, hey, what do you think about this? What do you think about that? And do what's best for the patient. So, big advantage, and everything is so state-of-the-art at Medical City. There's nothing lacking here.
What was it that attracted you to join this medical practice?
When you practice general internal medicine, I get to do everything every day, and that keeps it fresh and interesting because you never know what's going to come through the door from day to day, so every day is kind of like a surprise. And you really get to stretch your brain, which is what I enjoy, because for every patient that we see, there's always some little something that we need to consider, and you get to go back through and just really take a more thorough approach to it. It's kind of getting to be a jack of all trades, and I really enjoy what I do, and I can't imagine that I would ever do anything else.
She's really, really thorough. I don't care what I come in for, if it's a cough, she's a full makeup. If I come in for back pain, full makeup. So she's real thorough in what she does and makes me feel good, so I don't have to have her saying, come back and let me look at you again in 6 months. Everything she does for me, I know within a week. It might be small to you, but she takes it as like something that could seriously be big. I came in maybe a month ago about my back. I've been having back pain since I was in high school. She did an x-ray on me, did a full makeup on me, and in 3 days, she called me back and said, you're not crazy, you do have a little something going on with your back, but it's not going to require anything serious. You might just want to get a different bed, a mattress, and I'll give you some kind of exercises and things you can do. So I like the fact that she's thorough.
One looks around this group practice, it's extraordinary, the facilities that you have and the ability that you have to provide tests and things for your patients. It's unique.
Number one, we're in a professional building connected to the hospital, which is Medical City, Dallas, and it's very convenient to send patients over to do tests, to be admitted, to take care of them. It also allows me to run back and forth to the hospital to see them in the event I need to see them. That convenience is always there. Plus, the hospital provides a lot of resources I can do and have at my disposal to take care of a patient. Whether it's the ER next door, whether all the imaging that we can do, all the tests we can do, and also to get results back a lot faster versus sending them to an outside facility. And patients, sometimes they get confused running to one place to do tests, another place to do tests, whereas here you just take over the hospital, which is right next door. So there's a lot of convenience for the patient. It's more also for personal and psychological comfort as well, to know that their doctor supports their decision. Sometimes when you're sick, it's scary. It's anxiety-provoking, and they don't know sometimes how to make the decision. And sometimes I think they do make the right decision, but you help them along as well, and they trust you.
This practice is unique in that it has an extremely high patient satisfaction rating, among the top 10 nationally for offices of this size. Here, the doctors, the lab techs, and the staff all feel it's really important to have happy patients because, as they put it, happy patients are the most likely to be healthy patients.
We have a patient survey that is given to all patients to rate us, to let us know what we do well or what we don't do well, so that if necessary we can make different changes to keep things current and running smoothly for our practice. We do appreciate their feedback and want to make sure that we're handling things properly for them. As my role, that's part of it, to make sure that the nurses are doing what they need to do to make sure the patients are well cared for and happy.
One of the things that seems so impressive is the totality of services you have to offer the patients here. It really is very complete.
The doctors provide parking for the patients, which is a nice perk. We're one of the few practices that does that, so we do give them tokens or parking passes to pay for their parking. That shows that they go, one step beyond for their patients. We have 8 physicians. We have over 20,000 patients. We have 9 nurses. We're getting some new technologies in place that will streamline some of our practices, like something called ePrescribe, where we can do all of our prescription refills online. The pharmacy just emails us a request and we just email it right back. That's helped streamline our practice.
What about the doctors? Many of you have known each other for years. Do you all get along? You friends?
Well, that's the key. I mean, if physicians don't get along, then the practice will not be successful. And therefore, it's very crucial that we have the same philosophy. It's crucial that we feel like we can be friends outside work, and that makes the practice work very well. We are a specialist in all healthcare. We do from very basic things like a minor rash or an upper respiratory infection to something as complex and detailed as cancer, heart disease, or chronic lung conditions. And I think that's what an internist, if you are a good internist, you are prepared to take care of the patient from head to toe, whatever the complexity of their condition would be.
A unique look at Dallas Medical Specialists, conveniently located here in Medical City, Dallas, both of which are divisions of the Hospital Corporation of America family, which operates some of the finest medical facilities in America today. I'm Doug Llewellyn, reporting from Dallas.
That concludes this edition of Close Up on America's Business. If you'd like more information about any of the companies featured on today's show, please visit our website at closeuptvnews.com. I'm Jim Masters. Thanks for joining us, and we'll see you next time.